Okay, hello and welcome. My name is Jeffrey Horn. I work for the State of New Mexico Medical Assistance Division. And today we're going to be covering HR1 related Medicaid changes, or what's commonly referred to as the Big Beautiful Bill. Before we start, we wanted to mention that on behalf of my colleagues here at the HCA, we humbly acknowledge that we are on the unceded ancestral lands of the original peoples of the Pueblo, Apache, and Dene, past, present, and future. With gratitude, we pay our respects to the land and the people and the communities that contribute to what now is known as the great state of New Mexico. Right here is just kind of what the HCA stands for. It's the Healthcare Authority. Our mission is to ensure that New Mexicans attain the highest level of healthcare, providing whole person, cost effective, accessible, and high quality healthcare and safety net services, our vision, and our goals. So today we're going to go over a few things. We're going to go over HR1 changes, key dates, and when those changes are coming around, 6-month Medicaid renewals, retro Medicaid renewal changes, immigration changes related to HR1, work or activity requirements, exemptions where you may not have to participate, what happens if you don't comply or non-compliance, what may happen to your Medicaid, and being prepared and staying informed is what we really want to maintain at the end of the presentation. So right here, this is where we are at for HR1 Medicaid changes. Basically, what happened is the federal government passed a new law called HR1 in July of 2025 that instructed all state Medicaid programs to change how they administer some programs. So it changed some rules for us here in New Mexico. Currently, you see on the screen that we're over here in at the time of this taping in July of 2025. And the changes first go into, or July of 2026, excuse me, and the changes go into effect October 2026. It's important that you keep your information updated with us. You watch your email and you stay informed so you can keep your benefits. So key dates for the changes. Again, we're here in July of 2026. Starting October 1st of 2026, there's a new definition of non-citizens that may change those individuals' eligibility for what we call an adult Medicaid category. December 31st, we'll see renewals for the adult Medicaid category go from 12 months down to 6 months. So we're going to shorten renewals. And then starting January 1st, it's probably the biggest change that you're most aware of or that you're watching this video for. Work or activity requirements begin. So that's 80 hours a month of work, school, or training or community service. We're going to check for address and residency checks. So we'll be running a federal address match and we're making sure that you are a resident of New Mexico just to prevent you from receiving Medicaid in several states at one time, which is not allowed. And then what we'll do is we'll also utilize what we call the death master file from Social Security. And that's just to ensure that individuals who may have passed on no longer receive Medicaid eligibility. So we're going to go over these kind of one by one in several slides later on in this presentation, just so we all understand. So first, we're going to start off with our 6-month Medicaid renewal. The main category, and this is going to start for our recertifications in March of 2027, which is why this is in the top right-hand corner. But for our main category, our adult Medicaid group, and what we term here in the office as MAGI, other adult or COE 100, that's just individuals who are 19 to 64 who may not have children and they have a Medicaid category. That's most of these individuals that we're talking about here. They'll see their recertification period go from 12 months, which is a full year, down to 6 months. So you'll start renewing twice yearly. Most other Medicaid recipients in other categories will see no change. You'll remain on a 12-month renewal. And for our American Indians, Alaskan Natives, and Native American individuals, you're exempted from this change. Even if you are on an adult Medicaid category, you'll still see a 12-month certification period. And that's for any individual attesting to that heritage or bloodline. Um, Individuals who are currently approved for MAGI or adult Medicaid category, and you're not due to recertify until next year, your 6-month renewal will start at the point that you do that certification if it falls anytime after March of 2027. So we need to talk about another change that happens to retro Medicaid. Most individuals right now, currently, can apply for 3 months of retro Medicaid if you're on that adult Medicaid group. Starting January 1st of 2027, you'll see that reduced to only 1 month. All other Medicaid categories that have an ability to apply for retro Medicaid, we'll see that go from 3 months down to 2 months, starting again in January of 2027. So we did mention there'll be some immigration changes, and with HR1, the federal government changed what they define immigration categories that may be eligible for Medicaid. So beginning on October 1st of 2026, some lawfully residing immigrants who are currently eligible for that adult Medicaid group that we've been talking about may no longer be covered or eligible for that. Only the following immigrants will remain covered under that adult group. Legal permanent residents, commonly referred to as LPRs, keep in mind that they're still subject to other rules, including what we call the 5-year bar, which means you have to be here 5 years. Cuban or Haitian entrants, COFA migrants, which is Compact of Free Association, which is a lot of our Pacific Island states in that area. And lawfully residing children or pregnant women who are here and they're covered under a specific category, which we call Chipper 214. But that just means they're lawfully residing children or pregnant women who qualify still. New Mexico may be able to continue coverage for these immigrants that are no longer eligible for Medicaid using state-only funding. We are currently working on that process. More details will be coming out. If you do fall in this category, where you may no longer be eligible for Medicaid, keep a lookout of your mail, which is why it's important that you contact us and make sure we have the correct mailing address for you, your home address where you collect your mail, because we will be sending out notices to any affected party from this change. And those people will get more information on exactly what's happening, what's changing, and how to contact us if you have questions or concerns related to that change if you're part of this affected group. If you don't receive a notice saying that nothing's changing, you don't have to worry. And keep in mind that for our non-citizens, we still have what's called Emergency Services Medicaid for non-citizens, or what I like to term MSNAC. That's still available to you to apply for at any time at your local ISD office or at Yes, New Mexico. So now the point we come to is the biggest change, which is the work and activity rules or the work and activity requirements. So who would be required to comply? Again, we're talking about this adult Medicaid group. So it would apply to adults 19 to 64 eligible for or enrolled in the expansion group. So what we mean by that is our adult Medicaid category. You may have seen this on your correspondence labeled as Magi Other Adult Medicaid, or you may also know it by a number, which is called Category 100. That's these individuals. Again, just for simplicity, we're going to call it adult Medicaid here. So what are the worker activity requirements? Well, worker activity requires adult Medicaid individuals to complete at least 80 hours of qualifying activities in the month before you apply for Medicaid. So basically, when are you going to comply? Or when do you have to comply? New Medicaid applicants will have to comply 1 month before applying, and we'll go through exactly what these activities are and how to comply. And if you're currently active at your first renewal, you'll have to provide verification that you did 80 hours of work or activity requirements in 1 month prior to your last renewal period, or 6 months if that's your first renewal going into 2027. So what exactly are the worker activity? What is it? What does it mean? What does it mean? What are the hours? So basically, you can be enrolled in the information on the screen. Educational program enrollment at least half time in either high school, a GED program, college, career, or technical education. Or you can do 80 hours a month of the following: working, community service, or you're actively participating and cooperating in a work program such as SNAP Employment and Training, or another federal or state local program, like a TANF program too as well. or any combination of these activities, including the first bullet point, which is education. Or you could be residing, the final bullet point here, or you could be residing in a household group that has earned income from work or unearned income. That means like Social Security or veterans benefits or a pension, that you're receiving that in at least $580 a month or greater total. Or for our seasonal workers who may be working on farms or things like that, you're averaging a monthly total of $580 or greater over the last 6 months. So now I want to talk about some individuals that may qualify for some exemptions. What is an exemption? It just means that you qualify in one of these categories so you don't have to do the work rules. So you may be a parent or guardian or caretaker, relative or family caregiver of a dependent child under the age of 13 or a disabled individual. You could be a pregnant woman or individuals entitled to postpartum pregnant assistance for 12 months, entitled to or enrolled in Medicare Part A or Part B. You're covered under a foster youth or you're a former foster youth, covered under the adult group, ages 18 to 26. You're an American Indian, Alaska Native, or Native American, or you attest to having that blood. And you have a veteran with a disability. If you're a veteran with a disability, there's a little caveat to this rule. So it lists disability rated as total, which is a little confusing. So that would be either 100% permanent disability, 100% temporary disability, or you're receiving 100% combination, which could be a combination of several things from VA. Our veterans, you should know what that means. And again, if you have any questions or concerns with these exemptions or stuff like that, we'll go over how to contact my department at the end of the slides. Medically frail individuals, basically what we mean by medically frail, this means you have a severe mental, physical, or substance abuse illness that makes it difficult to work or do daily tasks. And then I've given a little bit of a list here of just common groups of individuals that would meet this definition, such as blindness, disability, substance abuse disorder, mental disorder, significant physical or intellectual disability. So basically what they're looking for here under this exemption is if there's something that prevents you from working, you have that medical disability and you're just unable to do the work. Individuals who are participating in a substance or alcohol abuse disorder treatment program, individuals who are already in compliance with work requirements under a TANF or SNAP, we already said that before, and individuals who are incarcerated or recently released for incarceration in the past 90 days. These all individuals will qualify for an exemption too as well. So we have other exemptions we call short-term hardships. If you're hospitalized, living in a nursing home, or similar facility seeking inpatient treatment, this exemption just has to be requested. All that individual has to do on that adult Medicaid group, just need to contact our department and just say, hey, I'm in the hospital, I'm receiving treatment, this is where I'm at, and then we'll take care of that from there. And then obviously, because you're in a hospital or nursing facility, you wouldn't be able to do the work, so you need that short-term exemption. Individuals having to travel outside their community to receive medical services to treat a serious or complex health condition for yourself or for a dependent that you're not able to get within your community. So for the state of New Mexico, travel outside your community we've defined as traveling 45 miles away from your home address or greater, and an overnight stay or staying there for at least 24 hours. If the travel is for a dependent, the adult of the group, so if you're traveling for a dependent, you're a dependent and you're an adult, you must travel with your dependent for the care, or you must attest that because of the travel, you're unable to make your work or activities because of this travel and or making Medicaid appointments or those related medical appointments is preventing you from doing those activities. Again, with these short-term hardships, again, it's important to contact us and let us know if you fall into any of these categories. And last, an individual living in a county under a federal emergency declaration or with a high unemployment rate, 8% or 1.5 times the national average. For that caveat right there, that little bullet point, the HCA will announce this on our website, and those individuals we will make known. So what happens if you don't comply in the work reporting requirements? Non-compliance in the mandatory work and activity requirements may lead to Medicaid termination. The HCA will be required to provide you a 30-day notice of non-compliance before taking any action or closing an individual for not meeting requirements. So if we deem that you're not complying, we're going to let you know first before terminating your Medicaid category. And it's important that if you get one of those notices that you take action on it and you contact our department and figure out ways that you can prevent you from losing Medicaid. If unfortunately you become denied or disenrolled from Medicaid due to noncompliance or for any other reason, we ask that you file a new application and reapply for Medicaid because we understand that you still may need the benefit and there still may be ways that we can help you. Keep in mind that when you file that new application, we're going to look in the month prior to your application just to re-trigger what we call a compliance check to see if you're meeting those worker activity rules so we can reactivate your Medicaid category. And so, for example, we're in July now. If I submit a July application, the HCA is going to look to see if I'm meeting the worker activity rules in June. So what we're here to do is we're here to help you keep your benefits in New Mexico. We understand that these changes are scary, and we're here to work with you to make sure that you keep your benefits and that we do all that we can for you. So what do you need to do as a community or as a Medicaid member to start preparing for these changes? Well, one, don't wait. Start getting ready now. Make sure your mailing address and phone number are up to date. Read letters from HCA right away. Watch out for renewal letters, applications, case notices, and respond quickly. Keep records of your income, the number of hours you're going to school or work, your volunteering in your community. Keep copies of pay stubs, school forms, volunteer logs. Keep all that information because that'll be important when we reach 2027 and those work and activity requirements start. And if you have any questions or concerns, always feel free to contact the HCA Consolidated Customer Service Center, or what we like to term CCSC, to keep us abreast of any changes. If you're moving, report it right away. If you have questions or concerns, give us a call. The phone number's in the corner, 1-800-283-4465, or you could set up an online account, which many of you might have already, at yes.nm.gov. And it's important to make sure that we have all your information correct so that you can keep those benefits in New Mexico. So be on the lookout for updates. Here at the HCA, we're going through the process of making sure that we're communicating with you in a timely manner, making sure that you understand the changes as they happen live. Changes are always happening, and we're working behind the scenes every day to make sure that you keep your benefits. So what we're promising for you is that we'll keep you up to date and keep on the lookout for mailers, TV spots, radio ads, social media posts, hashtag keep your benefits New Mexico, in-person presentations, and be on the lookout at our website. Here I got 3 kind of URL codes, or just what you type in your search bar, hca.nm.gov/Medicaid changes, or hca.nm.gov/keep your benefits New Mexico, or you can go to medicaid.gov/renew-info/nm/ and you can get information there. Basically, we want to make sure that we're communicating with you so you understand what's happening with your Medicaid benefits and that you can keep it. Again, our phone number, 1-800-283-4465. Thank you for your time, and I appreciate everyone out there. Have a nice day.